That turning now to mental health. The one thing we know about the Parkland shooter was that he was a young adult in crisis. Police had been called to the family home 18 times over the past decade for behavioral issues. Superintendent Runcie has hired an outside firm to audit the shooter's journey through Broward's school system from elementary school until his time at Marjory Stoneman Douglas. But he is not the only child in crisis.
The Association for Children's Mental Health estimates that 1 in 5 kids under the age of 17 has a diagnosable emotional, behavioral, or mental health disorder. So in large high schools with 3,500 students, as many as 700 kids could be in need of mental health services. Right now at schools across the nation, the ratio of students to a school psychologist is almost 1,400 to 1. Here in Florida, that ratio is higher, with almost 2,000 students per school psychologist. But there will soon be more money for kids and mental health. The MSD High School Safety Act adds $90 million in funding for student mental health services.
And we begin our conversation now on mental health with Miami-Dade school psychologist Frank Zanieri. Let's talk about this funding that's going to go now towards mental health. Is it because we need more counselors, more boots on the ground helping these students? You're in crisis management. You've been doing this for 20 years plus.
Yes, we absolutely need more. We don't have nearly enough of the school mental health professionals to address the concerns that you just heard. When we talk about 20% of our nation's school-age youth having an identifiable mental illness within a given school year, in Miami-Dade County Public Schools, that would account for about 75,000 children, most of which we have not identified as needing the help, and fewer yet that are receiving it. So we do need to have more counselors, more school psychologists, more school social workers, and even more importantly, they need to be allowed to do what they do best. We should not have counselors teaching academic courses instead of counseling children. That's a must. School psychologists and school social workers, with the many other things that they offer in their skill set, also can provide mental health services. Many years ago, I had a conversation with the former superintendent of Jefferson County Public Schools, where Columbine High School is located. And this was just prior to school opening, after the shootings at Columbine. And she said something of great wisdom to me. She said, you know, that first day back, I can surround the school with the National Guard, with all the local police. My students and my staff would feel perfectly physically safe. But psychologically, that's going to be a long road back. And this is where I see, of course, in a tragedy of this magnitude, the value of having those mental health resources in place, not just at the moment of crisis, but long term. We've learned from these unfortunate events around the country that up to 50% of students and staff exposed to the most acute phase of these types of events will suffer post-traumatic stress disorder. And some of them, at least 50%, will still be dealing and battling with it 3 years out. We've also seen that even those Columbine students, now in their late 30s, a number of them have debilitating anxiety and depression to the point they cannot hold down a job. Now, that doesn't mean that has to happen with the students from Stoneman Douglas. The resources are out there. The collaboration between the school mental health, community mental health is absolutely key. And if we work it from the angle of parent, home, family, mental health agencies, school mental health, and we triangulate all of that, then we have a much greater chance to have wraparound services that will support children, as well as our adults that are serving those children.
We have another Facebook question. Go ahead, Emma Kate. This is related to mental health.
Linda M. asks, what procedure do we have to deal with troubled students at school?
Well, there are a variety of ways we do deal with this. We certainly can work with them as far as a classroom setting and going into classrooms and working with teachers with interventions. We can have them work directly with counseling professionals, whether it be the school counselor, psychologist, or social worker. We have meetings, child study team meetings or student support team meetings, they're called differently in different districts, where we bring in all of the players at the table. The family, the student, the mental health professionals, the instructors, administration, and we problem solve. We try to identify what is impeding the progress of that child in being successful in school, whether it be academically, behaviorally, or socially, and work it until we resolve those problems. We work with the resources we have available to us, and if it is something grander in scale that we don't have sufficient resources, we tie into our community partners for more intensive work over a longer term.
I want to go ahead and bring in Dr. Mindy Cassell from the Children's Bereavement Center. Mindy, tell us about this new funding allocation that's coming from the law and how you're hopeful that it's going to be used for you getting some more people being referred to the Children's Bereavement Center.
Yes, when mental health funding was cut, we saw a dramatic decrease in the amount of referrals to the Children's Bereavement Center. We know that 1 in 5 children, 20%, are suffering a loss by the time they graduate high school. That does not even include a tragedy with the magnitude of what has happened here in Parkland. So we are hopeful that as schools are staffed with mental health professionals, we can partner with them to provide the much needed resource of long-term support as long as a family needs, and family-centered support so that everyone in the family can work together to help the child or each other.
Give us some idea of what your organization does for children who have lost a loved one, and this can be a cousin, a grandparent, anybody in their circle that they're suffering the loss of.
Yes, we do not discriminate on type of loss or who died. Whoever is important in that child's life, who is significant, we welcome them to the Children's Bereavement Center. And we see children and family members from age 4 on up, and the whole family attends. And children are in developmentally appropriate age groups with their peers. And what the group does is create a perspective. It gives an opportunity for children to be together with other kids and not feel so alone that they've had a loss, and not only to reduce that isolation, but whether it's a child or an adolescent or a parent or a caregiver, when someone else in that group says something that validates your feelings, that's important. So even if you can't articulate your grief, you can look at it, you can talk about it, and what we've seen is that group is a very powerful support in helping people adjust to loss. And this is an adjustment process. It takes a long time. It really does. People need the opportunity to reflect on their loss, to be able to control their feelings and have the opportunity to take the pain that they're experiencing and bring it out on the table and share it with others.
Well, and Angie Gallo, I want to bring you in on this a little bit. Let's talk about what parents are saying. I mean, I think perhaps before this conversation on mental health, we focus so much on money for academics and making sure that our students were reaching a certain level at a certain point in their academic career. But we weren't talking a lot about their mental health. And if you're suffering from a loss, or your parents are getting divorced, or something's going on in the home, it's hard for you to concentrate as a student. So talk a little bit about what you're hearing from parents as it relates to mental health.
You know, we hear a lot about academics, and I think we've seen this shift over the last 15 years towards a hardcore push on academics, and we've seen some of the other things go the wayside. And to mention to his point about guidance counselors and mental health counselors, we don't have mental health counselors in every high school. We don't have guidance counselors in every high school, and when we do have them, especially in elementary schools, which is where we need to pinpoint the kids, those are the kids that if we get them early enough and we intervene, and I'm no expert, but we get to those kids soon enough, we know that we can make a true difference. We can be impactful on that child. Those guidance counselors, they're in lunchrooms, they're in car duties, they're walking kids from one class to the next. They're not able to do what they need to do. And I was fortunate enough to sit at the round table with Governor Scott right after the tragedy. And one of the top guidance counselors said, when asked, how much of your week do you get to spend with kids? She goes, just with kids and not do anything else? And they said, yes. She said, maybe one day, but probably not even a full day. So we don't even have a full day where our guidance counselors can devote to these children. So I hear frustration from parents. I hear frustration that they're not getting their needs met, that these kids are stressed out, that it's too much, that they're over-tested, that they're overworked, that they need more breaks. We need a more holistic approach to how we teach our children, and we definitely have to pull in that mental health component so that we can make sure that we're getting kids the help they need sooner.
Superintendent Muncie, speak to that. I mean, you've got guidance counselors and doing other jobs. There's just not enough people in the school. There's not enough funding to hire more teachers, pay them what they deserve.
There aren't enough resources. We've got to do a better job investing in public education, I think, especially here in the state of Florida. There's been some movement over the last several years, but we certainly have a significant ways to go. At $7,300 per student in Florida, when a national average is over $11,000, it's a struggle. We've done some analysis on this, and that's absolutely correct. Guidance counselors have been doing a variety of things. And so what we started a couple years ago, recognizing that they were spending maybe half of their time in our high schools doing anything else but what their job profile indicated they should do. And one of them was actually test prep and test support and administration. So we actually hired test coordinators, a lower level role, to be able to take some of that off of the guidance counselors so they can spend their time doing what we actually hire them to do in schools. You know, I will say this whole topic of mental health is something that needs to come to the forefront of public education. The scope of what we have to do in public education has changed tremendously. We cannot properly educate students unless we deal with a lot of the social, emotional, and mental issues that they have come to school. There's something near maybe 50, 60, or 70% of children in this country suffer from adverse childhood experiences. We got to be able to recognize that and put supports in place so that we can get them in a position to learn, to be able to figure out how to cope with the challenges that they're facing. To ignore that, we do that at our peril. So we've got to rethink public education and recognize that these are resources that need to come into our public schools. We need to create a continuum of services outside of the school day so that there's adequate supports for that.
We have another Facebook question, and then I'll get to you, Mr. Zanieri. Go ahead, Emma Kate.
Alejandra R. says, as a parent, I want to know what are some of the signs of mental sickness in teenagers, and where can I go to find out more information on how to deal with that?
Dr. Zanieri, go ahead.
Okay, there are many types of mental conditions that certainly have their own symptoms along with them, and those can certainly be looked into online. The American Association, the National Association of School Psychologists, American Counseling Association, certainly the American Psychological Association will give you a complete listing of the variety of illnesses along with the symptomology that goes along with it. I would like to add, though, in terms of mental health and mental illness, and we've heard some excellent commentary about the value of social emotional learning and developing social emotional intelligence, basically. So children can grow and learn to navigate through the years in a way that they can reach their maximum potential. We heard about adverse childhood experiences. Years back, several years back, the Sandy Hook Advisory Commission came up with some data and some interesting facts about mental illness and its relationship to homicide, specifically gun homicides. They found that only 5% of all gun-related homicides were solely due just to mental illness. The other 95% had to do with a multitude of other factors. But 4 or 5 other factors they did find contributed heavily to these types of events. One, at least one childhood trauma, an inability to regulate your own behaviors and emotions, one, a positive social connection to an adult, at least, substance abuse, and access to a firearm. That was the conglomeration, so to speak, of ingredients that led children or troubled youth to, unfortunately, follow through in a very angry and horrific way in some cases. So whatever we can do to catch a broken child before they become an angry adolescent and a young adult who spouts out at the world in a really negative way is all the better. And the programming that we need to get in place has a lot to do with it.
I want to bring in one of our students, Daniela Link, if you could stand for us, please. She's also one of the students who participates in our student reporting labs as we partner with the PBS NewsHour. Tell us a little bit about what your fellow classmates are saying related to this whole issue, and perhaps in particular to the mental health issue. Do you have friends who are going through things and sometimes they find it difficult to talk to somebody about what they're going through and it affects their academic performance?
Well, I think a lot of students at my school right now it's actually great. We're being super involved. Like, we're really understanding what's going on. We're paying attention. We're keeping up. We're participating in the walkouts, the marches. We're trying to keep the conversation flowing in our student body. It definitely is an issue, mental health. A lot of people, it is a conversation that happens like at the lunch tables, or like you hear people whispering about it in the back of class, but like not really a lot happens with it, I guess. At my school, I personally don't really know what the procedure would be if I were to hear about a student like dealing with an issue like this. So I think it's really great that we're talking about it, that hopefully this is something we can implement in all the high schools, and yeah.
And I know that you were the one who spearheaded the walkout when all of the students walked out of school on March the 14th, the month after the shooting happened in Parkland. Tell us a little bit about what that was like as a student body to come together.
Yeah, so as soon as the tragedy happened, as soon as the tweets started coming out, as soon as the walkouts and marches have started to be planned, I knew right away that like this had to happen at my high school. I wanted it to happen at every single high school across the entire world. I really did. So it was really great. I'm a part of the student government at my school, so I was in a good position to be able to make this walkout happen. So the student government and all of the class officers from every single class, from the freshman class and the senior class, we came together and we scheduled a meeting with our principal, our vice principal, and our activities director to make this happen. They were very open to hear to what we had to say, which was super awesome that they were really understanding and allowing us to exercise our rights like that. So we made a plan to have all the students walk out to the field, walk across the parking lot, and walk around the field for 17 minutes to honor the victims. And it was also a great thing because as much as we wanted to protest and show that students won't be silent sitting in classrooms, we really wanted to honor the victims as well. We really wanted to remember them. So as we were walking around the field, we had someone in the commentator section. They said bios, they read off the students' names, and yeah, it was a good moment.
Thank you so much, Danielle. We really appreciate it. And that's all we have time for tonight. We hope that you'll stay engaged with us on Facebook, and we'll continue to follow these issues on our weekly public affairs program, Your South Florida. We hope that you will check it out. And as we say goodbye this evening, I want to thank our media partner, the South Florida Sun-Sentinel. And we want to say a special thank you to the Josephine S. Leiser Foundation. Its generous support made this evening of community conversation possible. To our panelists and to our audience, both in studio and online, we thank you for being with us tonight. South Florida is MSD strong. Good night.